Bedbound and unable to eat, her mother cared for her right to the very end.
She didn't have the energy to feed herself. She didn't have the energy to sit up. She couldn't chew. She didn't have the energy to chew.
Do you think she knew she was dying?
She knew she was at risk of death. She definitely knew she was dying when they wouldn't help her.
I'm Dr. Ray, a GP based in the UK, and how many more times is this going to happen until we start taking it seriously? So if you haven't seen that full story, go and check it out. But essentially it's about a young lady who was diagnosed with ME and was left untreated and not taken seriously and suffered from malnutrition and didn't make it. And in the inquest there was various reports from doctors, chief executives, stating how she was ignored or her symptoms weren't taken seriously enough. And one of the biggest things that came out of it, which is still true today, is a lack of a nationwide or even local service to cater for patients with ME. And this is something that has to change, and it starts with awareness and education, because I can't remember even being taught about ME at medical school. We may have had one lecture, but most of it was done post-graduation, especially when you consider ME is so complex. It can cause orthopedic problems, neurological problems, gastro problems, mental health problems, and it can span across so many specialities. Every doctor needs to be aware of it. I think patients with these chronic syndromes like ME or fibromyalgia are being let down the most in the NHS, and that's because they're not unwell enough to be treated acutely, and there's no recognised service for them to be managed long term, so they can't just left stuck without any treatment, looking to find treatments for themselves. And as medical professionals, we don't have the answers for it at the moment. So I think the first thing is recognising it and acknowledging patients when they come in with these symptoms, make sure we give accurate diagnosis and follow them up. And I know this is a system problem, but it's something we have to keep talking about to raise awareness, and hopefully the system can change. So in my next few videos, I'll be talking specifically about ME, how we diagnose it, what the complications can be, and treatments available.